So good morning, good afternoon, good evening, and depending on where you are. My name is Tandusi. I'm a consulting research fellow for the Health Effects Institute. Welcome to this last of a series of 4 webinars that we've been holding to discuss air pollution and health in East Africa. Before we begin, just some housekeeping announcements. Your chat is open, so you can feel free to introduce yourself, name, organization, where you're joining us from. In the course of this webinar, we'll encourage you to send in your questions through Q&A. We will have a dedicated session for discussion and questions at the end. Closed captioning is also turned on. And the webinar slides will be made available on the HEI website after this session. The slides for the previous session are also available on the website. Do also feel free to connect with us at the social media handles that you see on your screen there. So as we begin, just a few words on HEI. So we are a science organization that does independent research, providing trusted science, scientific review, and we do work outside of the US. We are US-based, but we do have programs in East Africa, South Asia, and for some time, Southeast Europe. So the work that we've been doing in East Africa is the reason we are here today. And some of the things we've done, as you see in the middle of your screen there, we have an interactive literature database, which is essentially a mapping of the studies on air pollution and health on 8 countries in East Africa. The darker the color, the more studies. So Kenya, Uganda has a few more studies than the rest of the subcontinent, the sub-region. So our global health also brings you the State of Global Air report. And you'll see on your top right, I think, a spotlight report that we did on Africa last year, 2022. Actually, that's 2 years ago now. And we do also, have the State of Global Air report, the last one for 2020. We are currently working on a new one for 2024. So that's a bit about HEI. And the reason we're here today is to discuss, opportunities for promoting integrated action on air pollution, energy, and climate in East Africa. So as I said, we have had a series of discussions starting from September last year, the first of which was on data, both on the air quality side and the health side. And in October, we had a follow-up webinar, the second in the series, where we discussed strengthening capacities for locally led research programs. And in November, we had the third in the series where we discussed communicating the air quality data. What does that take? Does all this PM 2.5 we keep talking about and all these gases make sense to the common man? And today we've taken that a notch higher. And based on the priorities that we see in this part of the world to do with infrastructure development, climate change, energy, the decisions that governments and the ordinary people have to make day to day. How can we promote integrated action that speaks to all these priorities, air pollution, energy, and climate change? So to take us through today's session, we have a rich agenda for you and 4 speakers. So we'll have some opening remarks and hear from our moderator for today on the African perspective in terms of air pollution and climate change action. We'll also hear on energy access and green growth in terms of investing in innovative local enterprise, local solutions across the continent. We'll have 2 kind of case study talks, one on household energy transition. How is that happening? How is the progress in Kenya? And we'll have a talk also on the health case for climate change, extreme heat, and improving maternal and neonatal health. Hopefully we'll have some time for discussion at the end and then close the session thereafter. So to take us through this session is our eminent panel of chairs and speakers. So Dr. Adrian Ambadi will be chairing the session for today. Ada, Sophie, and Adelaide will be our speakers for today's session. So without further ado, let me introduce Adriana, then hand over to her to take us through the session. So Dr. Adriana Ambadi is a chemical engineer with over 15 years of experience in air pollution, climate change, waste, and mobility. She's an atmospheric scientist conducting research on air quality. and an associate at the Stockholm Environment Institute. She sits in various scientific advisory panels and groups, such as the African Group on Atmospheric Sciences, ANGA. She also sits on the Scientific Steering Committee of the International Global Atmospheric Chemistry Project, or IGAC. She sits also on the Scientific Advisory Group of the WMO, World Met Organization, on reactive gases. She has delivered various projects and consultancies across Africa and South Asia for governments, working with national, city, and local governments, for development partners such as UNEP, Royal Academy of Engineering, Climate and Clean Air Coalition, CCAC, the African Union Commission, AUC, and the US State Department, and presently for the UNFCCC High-Level Climate Champions. She has built partnerships, including communities of practice of scientists and policymakers, with the inclusion of private sector, civil society, international NGOs, members, youth, and women. She's an alumnus of the Faculty of the Future Fellowships by the Schrumberger Foundation for Women in Science, Technology, Engineering, and Mathematics, STEM. She received her PhD from University of York, UK, and her research sought to support the evidence-based air quality management policies by assessing impacts of road transport emissions on human health and the environment, with a focus on African cities. Some of you might have met Adriana when she was doing, tailpipe emissions in Kenya. And that's my story. Adriana, let me hand over to you to take us through the session. Welcome.
Thank you very much, Victor. And indeed, I'm looking forward to seeing who I've met on this in this seminar, and also meeting new ones. So hopefully people are busy introducing themselves in the chat, and maybe meeting old friends, new friends, and making connections, which are essential for this kind of work that we do. So I will start off by giving this presentation, which is meant to be a scene setter for our webinar this afternoon. And to do so, I'd like to present to you the integrated assessment of air pollution and climate change for sustainable development in Africa. And I'm presenting on behalf of the assessment team, which some of you might be on this call, but others that are not on this, but there's many of us that did this assessment, and therefore I would like to acknowledge all of them. And at the end of this presentation, there will be a link to show how you can access the full report so that you're able to look at the detail, because in this presentation, I just give a snapshot. So, so let's start with the assessment. What is the assessment? It's a scientific assessment, and that was done since 2019. And we started off with wanting to understand and doing a very extensive consultation with the different stakeholders. And we came upon the African Union Agenda 2063, which describes the vision of the Africa would want as you move towards the year 2063. The African assessment, as the scientific assessment, aimed to examine and look at the challenges, implications, and also understand a range of alternative development pathways that may be taken to achieve those goals in Agenda 2063. More specifically, the assessment, as we put it together and started to understand how to do it, we wanted to look at how we can have an ambitious development plan for Africa, but we proceed at the same time as reducing air pollution and ensuring that we're improving health and well-being, but also limiting impacts on ecosystems and helping to avoid climate change impacts. But we also wanted to provide appropriate and timely actions to inform planning by governments and other stakeholders, and explore different modeling options, which had at the heart of it the African community of practice and data and information, complemented with our international colleagues and partners as well. But also understand how the synergies and the trade-offs play against each other. But just for those who are not involved in modeling at all and that don't have an idea on modeling, just to let you know that modeling really is not a way of looking into the future to understand. It doesn't determine the best path, but it helps to inform and facilitate discussions on this topic. So with that, we started doing the consultation that I talked about, and we did the really extensive consultations with at different level, at the regional level, at the continental level, national, subnational, and local and community level. But we came upon the African Ministerial Conference for Environment, whose secretariat is hosted at UNEP. And this Secretariat of African Ministers back in Durban in 2019 actually saw it fit to support the assessment, the scientific assessment, and they saw the need for it. They agreed to emphasize the benefits of improving and including managing air quality, short-lived climate pollutants, looking at the different sectors, and also incorporating into that the Agenda 2063 and the Sustainable Development Goals. And it was important that the ministers saw that immediately there's a linkage between science and policy, and they wanted that to be brought to the front. And from this endorsement from the all environment ministers in Africa, a partnership was formed between the African Union Commission, UNEP, Stockholm Environment Institute, and Climate and Clean Air Coalition. So following that first ministerial declaration, we actually went back once the assessment was produced. So you're looking back, I'm looking forward to 2022, starting from that 2019. And at the time, we presented the main messages and recommendations from the assessment as we were completing the assessment. And it was important to go back to the ministers to report, because in that conference, you get a chance to speak to the technical working groups of climate change, where this was domiciled. There's another technical working group for biodiversity and another technical working group for pollution and chemicals and pollution. So in these working groups, the technical groups, those report to the ministers then report to the CAHOS. I don't know if you have heard about that. That is the association of all the different presidents that work on climate change in Africa. So you can see that that policy process goes all the way up to the presidential and prime minister level. So in noting the completion of the assessment, the ministers urged for our implementation of those 37 measures that are found to be measures that can improve air pollution, but also improve all the other impacts that go with air pollution and also climate change. But they also urged for this to be taken up at country-led initiatives, but cascaded to the regional economic communities, which include the East African Community, the SADC, ECOWAS, and North Africa. So in this, it ensures that this is not just a report that is a once-off, that those measures are then implemented, which are the different 37 measures in the 5 areas, which I'll show in the next slide. So I guess the what I'm trying to show you here is that it actually ensured there's a formation of a community of practice that involved many different institutions, many different practitioners through the continent and globally. So when we first started off the assessment, we sent out, we called out to authors, reviewers, and modelers to join us, and we had over 100 applications. And from these 100 applications, over 100 applications, we had over 100 authors from 17 African countries attend the first author meeting. And at the heart of it, we wanted to ensure there's capacity building, and we had provided a platform for knowledge sharing, as well as inclusion of early career professionals. Then we made sure that we linked to policies that I've introduced, the African Union Agenda 2063, but also SDGs, Paris Agreement, the UNEA resolutions, and regional, sub-regional air quality agreements, NDCs, and air quality management as it exists on the continent. We also formed a robust modeling group that ensured that there was knowledge exchange and capacity building, but also ensuring that they built the framework from the beginning and agreed on the different scenarios, and as well as ensure that we have modeling seminars such as the one we're having today, but it's more focused on modeling. We also ensured that we had regional economic communities as well as member countries through a focal nominations. And the focal nominations were called through the Ministry of Environment, and we had over 30 countries represented. As well as we had an international advisory group that comprised, but not limited to, the following institutions, including UNEP, FAO, WHO, IEA, AHME, US EPA, IASA, WASCAL, and IMO. Now, it sounds like the alphabet soup, but hopefully if you're in this field, then some of those different institutions actually are familiar to you. So when we started doing the assessment, we realized very fast there are 5 big areas that we need to assess in terms of looking at how we can act to protect human health and environment. And the interesting thing with the assessment is that during the consultation process with our different partners, we realized that we all agreed that human health was the greatest entry point to ensure that the entire ecosystem of stakeholders actually buys into the assessment and also looks and looks to embed the 37 measures within their own policy processes so that is taken forward. So the 5 sectors are energy, and looking at energy, and it's indeed the topic of this webinar this afternoon. We looked at looking at uptake of renewable energies, phasing out HFCs, looking at energy efficiency, but also capturing methane. And then in the residential sector, we looked at clean cooking, and I'm happy to report in this session we'll have an expert in clean cooking. And then we also looked at household energy efficiency. In the agricultural sector, which is one of the biggest sectors in Africa, we looked at reducing food waste. How do healthier diets translate to impact on human health and environment, reducing methane emissions, more efficient livestock and manure practices, as well as elimination of crop residues, elimination of burning of crop residues. And then the 4th sector was the transport sector that a lot of you are familiar with, and that was investment in the future to better public transport, the uptake of electric transportation, mobility, and then looking at cleaner vehicles. However, that translates into better vehicle emission standards and better fuel standards, as well as non-motorized transport. Last but not least was waste, and in fact, where I work at the Climate Champions, I work on waste and looking at elimination of open waste burning. So that also featured in the scenarios within this sector, as well as composting and reduction of organic waste, as well as reduction of all kinds of waste. So those are the 5 sectors, and I call them the big 5. So it's easy to remember because if you're in Africa, I'm sure you've heard about the big 5. So the big 5 for the assessment integrating air pollution and climate change are those 5 sectors. And how do those 5 sectors map out into the 37 measures? So when you look at these are things that are already probably familiar, you're already familiar with. And so when you look at the energy sector, we are looking, for example, something like efficient charcoal making, and I'm sure there are experts on this call that are able to speak to that. But charcoal making, use of biomass in our cooking, lighting, heating is something that will go on for the foreseeable future unless something changes. And I hope there are best practices within this session that highlight that. But also oil and gas methane emissions, coal methane capture, and for example, the energy efficiency once again. So in the agricultural sector, we look, for example, at looking at how we can improve digestibility of feeds for animals, for our livestock. We looked at biomass burning and food waste, and including diet. Then for the transport sector, as I mentioned before, inclusion of hybrid vehicles, which are already existing on our roads. I know that I've seen them, a lot of them in Nairobi and other East African countries as well, as they're imported from different countries. Non-motorized transport, which is very important because majority of our population in East Africa actually walks or cycles to get to work or school. And then, of course, electrification of all different fleets. And then the residential measures, as I mentioned, clean cooking, but also air conditioning. Some countries in Africa are really hot already. So how can we look at cooling, efficient cooling and conditioning so that we're not using that it's in an energy efficient way. Then waste, many different uses of waste, including our liquid and solid waste, where there's methane capture and using the methane capture in our landfills and formalizing our open waste dumps to landfill sites and other sustainable waste management practices. And of course, not to be left out, it's important to remember that sanitation is also a challenge that also impacts on air pollution and climate change that can also be harnessed actually for energy use. So that's how the 37 measures map out into the 5 sectors. And just remind you at the end of this presentation, you will have the access to the report if you already haven't done so. So how does the snapshot of the initial results coming from the assessment look like? So on the right-hand side, that's how the report looks like when you get downloaded on the website. But when you look at reducing emissions, when you look at emissions reductions, we look at greenhouse gases, short-lived climate pollutants, and other pollutants. The snapshot shows that you can reduce those up to 40 to 80% through the different measures. And then reduce premature mortality. We can prevent up to 200,000 premature deaths per year by 2030. And then 880,000 deaths per year by 2063 when you combine outdoor and indoor air pollution. Then improving food security, we can actually reduce the desertification and increase crop yield from the very important food crops that we have in Africa, including rice, maize, soy, and wheat. Then the climate change benefits include limiting the negative effects of regional climate, especially on rainfall. And this interface between rainfall and climate change and air pollution actually allowed for us to look at the narrative of not just mitigation in terms of climate change, but also adaptation. And these changes were especially seen limiting the changes or the negative changes in the Sahel region and the temperate parts of Africa. And I do not know where this is stuck. Okay, so I'm going to stop sharing and see if I can move to the next slide. Just give me a moment. Are you able to see it?
Yeah, we can see it. Just do full screen.
Is the full screen come on?
Yes, yes.
Ah, and it moved. Miracles. So I wanted to show you also a snapshot of the results. There's 11 pollutants that we looked at, and including carbon dioxide, methane, hydrofluorocarbons, black carbon, organic carbon, particulate matter, and nitrogen oxides, all the way to carbon monoxide. And you can see the reductions when you compare against the baseline of 2000 to 2063. There's reductions of carbon dioxide up to 55%, methane 74%, black carbon 72%, PM 2.5, which is of interest here, up to negative 75%. So you got reduced by 75% by the year 2063 against the baseline. And NOx is up to 80%. So that's good news. When you implement the measures, which are called the short-lived climate pollutant measures, when you look at the Agenda 2063 as two important measures, then there's that kind of reduction that ranges anything from 55 to 98%. So what about health? And I know a lot of people here are interested about health. The good news is that when you look at policy interventions against the baseline, so if you go with the baseline, which means business as usual, the number of premature deaths from outdoor air pollution will increase up to 930,000 deaths per year in 2030, and then 1.6 million per year in 2063. But if we implement Agenda 2063, which consisted of 24 energy sector measures and 30 non-energy sector measures, then we see that 180,000 premature deaths can be avoided from outdoor air pollution by 2030, and that rises to about 800,000 in 2063. So that's good news. In taking action in all these different measures, which are energy measures, non-energy measures, we actually reduce the number of premature deaths per year. Then in Agenda 2063, in addition, which included the indoor air pollution, we can see a reduction of 20,000 deaths in addition to the ones I've shown, and 80,000, that rises to about 80,000 avoided premature deaths by 2063. And I think this is very interesting for people who are working in the clean cooking arena. And then the charts below you, which are rather small, but you'll be able to see in more detail in the report, we were able to aggregate these results to sub-regional levels. So you can see this Northern Africa, Western Africa, Central Africa, Southern Africa, East Africa. And against that, we look at the WHO Interim Target 1 and WHO Air Quality Guidelines level. So if you compare the baseline versus the short-lived climate pollutants, you can see in the baseline, all the regions, all the sub-regions, the air pollution levels increase quite rapidly from the baseline to 2063. But then if you implement the short-lived climate scenarios, there's not rapid reductions apart from the West Africa, but you see for East Africa, it remains more or less at a level that is below the interim target 1, but also still above WHO air quality guidelines level. So that means it's not perfect, but it is a definite improvement, and we have shown that the impact on health. And same for Agenda 2063. So that tells us that within the regions, when you look at the different sub-regions, there's similar trends where they're showing that there's a decrease in the population-weighted PM 2.5 air quality levels. So that's the snapshot for the different regions, including East Africa, and this information is also available at national level. So for 55 countries in Africa, each country will have at national level inventories that show the similar impact at the national level, so for the different countries. So to end this, and I know it's been a whirlwind of the assessment, and you have to think this work was from 2019 to 2023. So I always joke that it was yet another PhD. But it was a life's work for that number of years with hundreds and hundreds of scientists and policymakers involved in this to ensure that the process has local support, but also embedded within the local processes so that they take forward the implementation, so that that is embedded in all the different planning within the countries and at different levels. So if you recall, the AMSEN resolution in 2022 called for a continental clean air program, and we had the first consultation. And we found that this clean air program for the continent is already contained within the Agenda 2063, which says we aim to have better air quality at continental level and healthier and more livable cities. As well as this also helps us to meet objectives of SDGs, including SDG 3, 7, 11, and 13, and the objectives of the African Union on climate change, and is also now captured in the African Union Climate Change and Resilient Development Strategy and Action Plan, which takes us from 2022 to 2032. So I'd like to end here by giving the last slide that gives you the link, and I'll put the link in the chat so that you're able to download the report. The report is in different chapters, and once you're able to download the different chapters, you'll be able to go through. And this information, if you go through to the LEAP website and actually register as a developing country researcher or scientist, you'll be able to access those inventories and information that were coming from this assessment. So thank you very much, and I'll stop here. Hopefully you could still hear me and I was not talking to myself. You see, I forgot I was sharing. I like the way Victor just kept quiet and he looked at me. He was like, yeah. So I was like, yes, I'm waiting for you to say something. So thank you so much for listening through to that. And I see a lot of chats coming through. So hopefully, Victor, you'll keep an eye out for the chats if there's any particular questions to address. And so I would like to actually invite our next speaker and encourage you to keep putting those comments in there and questions, and also hold off for the questions at the end of this. So I would like to actually ask Ada who is here already, who's going to be our next presenter. And I would like to give you a little bit of a snapshot of Ada's career. So Ada Mamion is the Director of Partnerships, Knowledge and Impacts at the Africa Enterprise Challenge Fund. She's an experienced team leader with 12 years experience in renewable energy, climate change, inclusive finance, innovation design, business advisory, fundraising, strategic partnership development and portfolio development in Sub-Saharan Africa and Europe, in both for-profit and development sector. She holds an MSc in Environment and Development from King's College in the UK and an MA in International Affairs from Sciences Po, France, and is a registered member of the African Circular Economy Network. So a fellow waste management expert and enthusiast. I'm really happy to introduce you, Ada, and most welcome to proceed. Thank you.
Thank you so much for this nice introduction, Andriana. Can everybody hear me well? Okay, great. So greetings from Nairobi. Good morning to the US participants, and good afternoon to the East African ones. Nice to be in the discussion on pollution, health impact, and clean air for me, because it's also an opportunity to learn a lot about more science work. Of course, at ACF, we mostly look at it from a perspective of an investor, which is what I'm going to share with you. However, indeed, the impact that our investment may have on health, on public health, and the environmental impact and the climate mitigation and adaptation benefits is very big on our agenda. So I'm very curious to hear and learn also from you and from this group how you might measure health impact, specifically from the type of technologies that I'm going to mention. And I would love to explore collaboration further on that. So perhaps a few words on the AECF. AECF is a not-for-profit fund manager. So basically we invest funds from public sources mostly, or philanthropic foundations, into small and medium-scale enterprises that operate in sub-Saharan Africa with a focus on fragile and conflict-prone markets. And that those SMEs are offering and deploying products and services that build a resilience to climate change, to economic shocks, and to, let's say, the incidence of poverty on marginalized and rural communities. So we've been operating since 2008, and since then we have invested over $450 million into over 420 SMEs. Most of them are in climate smart agriculture or renewable energy and energy access. Across sub-Saharan Africa in 26 different countries, but of course we have a large part of our portfolio that is in East Africa. And perhaps today I'll focus a bit more on our mitigation portfolio and investment in renewable energies and energy access businesses at large, and how that might impact on health variables, but also pollution and the ability of productive sectors to mitigate the impact of climate change. Our investee companies have impacted over 30 million lives and catalyzed almost $2 billion of net development impact. So we basically run challenge competitions that are publicly open for everybody to bid for. And when we say challenge, we will look at a very specific climate or social inclusion related challenge, define it precisely in a context, be it a geography or a type of market, and then open the floor to the market players to give us ideas, to give us solutions, and we would then invest in them to deliver more impact. So because we have Sophie from Coco Network on the panel, and Coco Network is one of ACF's investee, and she's probably going to focus our discussion on the household impact of clean cooking. I decided to focus mine on the impact of investing in renewable energy and clean energy technologies for businesses, for commercial and industrial players, and for institutions, i.e. schools and clinics, rural clinics. So at ACF, we have invested in the last 10 years in about 28 companies that are either delivering solar mini grid, so that's a decentralized solar-powered electricity generation system that either connects off-grid communities or hybridize or transfer from diesel generators an existing installation into solar. We in those 28 companies, we also have a number of companies that sell standalone solar system that we call productive use of energy. Those could be solar-powered cold storage rooms, solar-powered irrigation systems, and a number of productive assets, for instance, in fisheries, such as fish dryers. And we also have funded quite a number of companies that install what we call captive plants. Those are solar power systems on one specific industrial site or agro-processor or commercial user, could be a hotel, could be a restaurant. And that is often to replace diesel backup. So perhaps the focus of our discussion today, at least with me, is how have our investments, and we are talking about $14 million invested in those 28 companies, have been really aiming at testing and supporting different business models and products to remove or to displace diesel as a source of main source of energy generation, or diesel gensets as backup for micro, small, medium scale enterprises or school and clinics. In the school and rural clinics, we have also seen a lot of solar power systems to fuel to power refrigerators for vaccines, or access to internet, either for education purposes or for enabling remote doctor's appointments, or even interventions or giving birth, as well as fetal scan machines in kits. In schools, we have seen a lot of work being done to increase the number of hours of daylight of lights for students in dorms, but also pumping water for sanitation and potable water for school communities. And of course, a lot of investment also in clean cooking in institutional setups such as school. So why are we focusing so much on removing or displacing diesel? The use of diesel generator is huge in sub-Saharan Africa. In 2023, we had 6.5 million generators active just for backup in sub-Saharan Africa. And that's as much installed capacity as power plants supplying the grid. And their maintenance, the fuel cost, and their procurement, so not the asset, is costing the continent $13 billion per year, which is about 15% of what is being spent on healthcare system. If you look at the impact in terms of climate impacts of gensets, the CO2 emissions from genset for backup system alone is equal. So I'm not talking about the large diesel-based power generation plants of 50 to 100 megawatts. I'm really talking about the small ones that would be in a business or in a household. And their total emission is equivalent to 20% of the emissions from all cars driving in sub-Saharan Africa. So we anticipate this situation to get much worse, both in terms of costs, because the cost of diesel is growing, but also in terms of impacts and amounts, because the population is growing, and the energy supply situation from the main grid is deteriorating across East Africa, but also Southern Africa. So we have invested in quite massively in testing different customer accessibility models so that commercial, industrial, agro-processor, or schools, clinics could switch from using diesel genset to using solar genset, or mini grid operators could hybridize their systems. At the moment, what we are seeing is that there is a very big need to work out also with smart subsidies the financial sustainability of this solarization. There is also still a need to increase awareness of customers about the cost benefits of them investing in solarizing their systems. but we are very confident that the health impact is already observable and noticeable. I think there will be also a big impact in terms of balance of payments of a lot of African countries that are currently struggling with heavy currency depreciation and worsening level of government debt. So it's really both a climate and a health issue, but also an economic local economic development issue. I forgot to mention that ACF invests also a lot in hard to reach places or refugee camps, for instance, where again across Africa the humanitarian sector has been massively relying on diesel, genset and generators to bring basic services to refugee population that are on the rise again in East Africa due to conflicts affecting a few of our neighbors, and I'm sitting in Kenya. So there is also a big need to rapidly deploy solar and hybridized capacity in the case of displacement of communities. And we might be talking millions of people at any given time. So it's not a small shift. Yeah, maybe I'll stop there. I've been talking quite a lot, so happy to, to take questions and to answer questions as well. But thank you for listening.
Phenomenal. That is really a very amazing talk. And it sort of bridges the things that I keep saying on the implementation and understanding what these different measures mean at very much a community level, looking at schools and hospitals, but going by the numbers where it starts to feel like it's a continental impact. So it's really wonderful to hear this. And I think before we move on to the questions we have for you, Ada, I think I want just to remind us in the audience, she's created such a vivid picture that we all grew up with, those who have grown in the East African region, and most likely other parts of Africa. I will say three things to you. I will say, Nishikia Nitandike, those who know what that means. It means, so hold, I make the bed. So we used to use candles. And those things are very flammable, big accidents from this. And of course, if you live in a plot in our urban centers, you know about paraffin stoves. If you start cooking, you need to open everything because it stinks from paraffin used from the paraffin stove. And of course, the paraffin stove is responsible for thousands of deaths in informal settlements where those building structures catch fire. So not only we're talking about relating it to air pollution related mortalities, but we're talking about deaths as well from accidental fires. And then last but not least, the humming of generators. And I know that our West African colleagues as well as East African know very well that when you listen very quietly in the most quiet area, you can hear diesel humming even in the most expensive neighborhoods. So that is the kind of imagery that we have grown up with, but at least we also live in this generation where we're able to see the kind of changes that Ada has introduced. So with that, I'd like to put the first question to Ada. The question that has been asked is, what do you consider as the greatest challenges and opportunities in sustaining and promoting locally developed solutions and enterprises across Africa?
Thank you for this question. And of course, AECF being an African-owned organization, we try as much as possible and really to push for investing in locally owned businesses that are coming from the communities and aiming to find solutions that are curated to the needs. So of course, this is making their solution and their footprint and their impact in the communities very strong. We see in terms of opportunities that local founders have been more resilient in terms of crisis or rapidly shifting situation. They have a more solid support network. They have a very deep drive for impact. They understand the challenges and the needs of their community that they are aiming to serve. But indeed, in the more on the challenge side and looking at it from an investor perspective, the scalability of very local grassroots solutions is a big deal. Also, the access of local businesses to the network amongst investors that will help them secure the necessary funding to have a solid base is often not there, and therefore that makes them very vulnerable to drops, for instance, in income from customer sales. Because of scale and lack of economies of scale, often the local companies are finding it difficult to meet their break-even point, to have your unit economics that makes commercial sense or that releases large enough profit margins for them to be able to grow and scale. So that's a big challenge. And also access to the right capital at the right time. So ACF's type of capital is there to kind of bridge this gap, be the high risk, patient, early stage capital that you can use as a local entrepreneur to really get started on your growth journey. But we still see that there is a big gap between our capital and the more commercial impact investment available in the region. And in energy access, anyway, 90+% of the investments in the last 5 years have gone to international or foreign-owned SMEs, and that's for the energy access space. And the sector is very much concentrating, which means that not necessarily the locally owned businesses are shutting down, but maybe they are changing role in the supply chain or in the sector, and more becoming distributors of products from larger international organizations. And that's maybe a good segue to what Sophie will talk about in terms of delivery model, access to market, and how a company like Coco is making their product accessible to people.
Thank you very much, Ada. That's indeed very interesting. And thank you for also bringing up the issue of access to finance, and within the landscape of East Africa, where we have, or at least it's seen, the perception is that there is a lot of foreign-owned SMEs, especially in the energy space. And I would like to say foreign-owned and mostly male foreign-owned. So again, I would like to thank Victor for assembling this panel and having, in case you have not noticed, an all-female panel. So that's pretty cool. So Victor, is it over to Pallavi, I believe?
Yeah.
Over to you, Pallavi.
Yeah, thank you, Andriana. We just don't want you to do too many jobs all at the same time. And there were a few questions here also on your doc. I'll start with perhaps an easy one, which is, in looking at the transport sector measures, did you also consider road traffic accidents as part of the sort of suite of measures that were proposed?
Thank you very much, Pallavi. We didn't, but there is a tool that I have knowledge of from WHO that does look at road accidents in addition to air pollution. So I will look up the link and share following this for those who might be interested in doing that. But it's a really important question because the incidence of accidents on the continent does not it's not directly related to how many vehicles we have. So we have very low motorization still when you look at four-wheeled vehicles. But when you include the two wheels, the motorization rates are increasing. But as those motorization rates are increasing, the number of accidents are growing exponentially on the continent and in East Africa. In fact, I remember when I was still doing my research as a student, hearing that there are parts of the hospital that are called border wards, which means all the different accidents from people who are on two-wheelers go to that ward, and they have it's really very devastating accidents, and you can imagine that translates to household impact, community, national and continental. So really important question, and one to always link because Clean vehicles, incidentally, are also safe vehicles, whereas the older vehicles that are dirtier vehicles are also unsafe vehicles. So it's a narrative to ensure that we always speak with it together. Thank you.
Perfect. Thank you so much. If there's any researchers listening to this, here's a question for you to think about. Another question we had from Jana, if I'm pronouncing the name correctly, is whether, you know, among all of the measures that you talk about, is there a priority list when it comes to reductions in the pollutants, so that there can be a phased approach and, you know, probably people don't have to do or undertake all of the measures together? And if there is a priority list, then how is that priority list, you know, determined, and what pollutants should we focus on first? How did you come about that decision?
I think somebody is trying to make me play favorites with my babies. All pollutants are important. Obviously, when you're looking at health, there's specific pollutants that will be of interest. But I think what we're making is a case of action for the 37 measures. But having said that, if you look, for example, at the transport sector, for example, that I have extensive knowledge from the assessment, because I was with the transport and the waste. So the transport measure, when you look at investment in public transportation, that is a winner on all ways and something our countries are already doing. And one that is a pathway that is encouraged always, because you can move more people together more cheaply, but also better for the environment, better for health, etc. So investment in public transport, for example, I would say as in a phased approach is one to consider first. But then, of course, there's non-motorized transport. Like I said, if more than 70% of our populations walk and cycle, where is there not infrastructure to match that? So that should be an investment point. And then, of course, there is other use of the cleaner fuels, cleaner vehicle standards, which incidentally for Africa, where there's not a huge vehicle manufacturing facility apart from specific countries, since we import, we could as well be importing cleaner countries and East Africa, cleaner vehicles, and East Africa has done that. And then, of course, last but not least, and the one that you can still undertake with all the others, because then you look at a stacked way of looking at the measures, then is electric fleets. So that that also impacts and has impact on all the other different sectors. So that's just giving you an example. So what I would encourage for you to do following this, this is to be able to log on to the LEAP and be able to access the inventories and play around with the data. It's there, the measures can be reduced. So think of it as a stacked chart. So if you start out with 100% electric fleets, obviously that is the best measure you can have. But then you can start off with 20% and then stack that up with public transport, with the cleaner vehicle emissions and standards, and see how that plays, change that as it goes forward. And that's what the modeling is actually really good for. And that's where the information is actually open for people to do so. Thank you.
Fantastic. It's an excellent resource. And I'll maybe ask you one more question, combining what Ethan and Aaron have asked us. So one is, you know, did the modeling in ranking the priority list also look at the benefits and costs? So was a, you know, cost benefit analysis or similar assessment involved? And then the other question is, you know, looking into the future and estimating what the potential health benefits might be, were you also taking into account the changes in demographics, the population growth, baseline, you know, disease rates? Were all of those types of things considered in coming up with these estimates?
One assessment to end them all. Of course, it never works like that. And Pallavi is smiling because she knows it. That's the case. So once again, we did not do the benefits and cost analysis. We wanted to. Since we decided doing this since 2019, I think it was time to finish. But accept this is not a finished product, rather a resource that can now be used to extend that. Of course, working with institutes such as yourself, then it means you are the experts to look at health and the cost benefit analysis from that going forward, and also the different considerations for confounding factors, looking at other diseases. But for sure, we did include, we did actually have consideration. Sorry, I got caught out by the chart on the side. We did have the consideration for population growth and economic changes. Those are also included in the model. Thank you.
Thank you, Adriana. I know this was a mammoth effort, probably 10 PhDs and not just one. But I think there are probably going to be more questions along the way, but I know we have another couple of excellent speakers, so I'll hand this back to you now. Thank you.
So Victor is very clever because he asked me to do this while I was on holiday. So when people ask me things to do on holiday, I'm usually like, yes, yes, yes. So this is how I ended up with it. But it's really exciting. And I would like to immediately introduce our next speaker, Sophie. Sophie is actually well known to a lot of you, and I'm really excited to have her on this panel. Sophie is a government and stakeholder relations, business strategy and communications expert with multiple years experience across private and public sector. She holds the position of Group Head of Public Affairs at Cocoa Networks, where she's responsible for engaging governments to understand how cocoa fuel can enable the transition from charcoal and firewood to a clean and renewable energy source. In addition, she loves engaging with various audiences to understand the role of carbon markets as an enabler. She's passionate about making a difference in the lives of women, children, and community at large. Most welcome, Sophie.
Thank you so much, Adriana. Thank you all. Good morning, good afternoon, wherever you are. Reaching you from Nairobi, Kenya as well, and happy for the opportunity to speak to the transformation that is happening within the clean cooking sector and how it is delivering a positive impact, specifically on health. Next slide, Victor. So who is Cocoa Networks? Cocoa Networks, we have been in Kenya since 2014. So we're about to hit 10 years. We came into Kenya on having a dream that we could provide a scalable solution that uses bioethanol to solve for the use of charcoal and firewood and kerosene, which I think has been spoken to by Adriana. So for us, we use technology, and our bioethanol is sustainably sourced to enable us provide a modern cooking experience. We know that charcoal is the leading cause of deforestation across many countries, and we are committed to making the transition from charcoal so that we can actually keep our forests in the ground. We did spend 5 years doing R&D. The solution is developed in Kenya. We spent time understanding, being in homes, seeing what was happening. We did see firsthand the pollution that you speak about, kerosene pollution, what happens when people use charcoal in homes with very limited ventilation. And that enabled us to develop multiple iterations until we launched in 2019 with our 6th iteration. As of now, we are present in 15 cities across Kenya and Rwanda, employing over 1,800 staff across those 4 countries. And we have received coverage of this innovative solution across many areas. Next slide, please. So when we look at Kenya specifically, just go back. Okay, next slide. So looking at the charcoal market, we know it's very informal in very many countries. It is worth an estimated 25 billion. And majority of this revenue does not pass through the hands of government. So government is not getting any revenue from this to be able to provide social and other benefits. We find that there are 4.4 million hectares of forest that are cut down each year. 900 million tons of carbon dioxide equivalent or emissions, again, every year. And unfortunately, and as has been alluded, due to the proximity of women and children to the smoke and the pollution from the polluting fuels that they use, unfortunately, we lose about 650,000 people across Africa every year. Next slide, please. Now, Kenya pronounced itself around 2018 that we will achieve 100% universal clean cooking by 2028, which is 2 years ahead of the SDG goal. But when we think about what is the reality on the ground, charcoal and wood have about 72% of the market, primarily with charcoal being the predominant fuel in low-income areas, in urban areas, and you find firewood primarily in the rural, peri-urban and rural areas. And as we said, the impact of deforestation on water cover, forest cover, and therefore disrupting the water cycle. And we know a lot of countries in Africa rely on rain-fed agriculture. So we realize the impacts of this are far-reaching, specifically in Kenya in terms of the rate of loss. We lose about 22,000 people every year, which is more than when you think about road traffic accidents and some other ailments. It's more than the number of people combined. We lose about 400 people per day. And majority of these are women. We know are children. We know that children are either on the backs of their mothers or they stand quite close to the mother when she's cooking. And unfortunately, this household air pollution leads to breathing problems in addition to eye problems. And government of Kenya did a study where they determined that the amount of money spent treating respiratory infections is about 33 billion. So you can imagine the impact of transitioning households from using greenhouse gas emitting fuels to a clean fuel. The impact would be far-reaching, even from a financial aspect. Next slide, please. Now, specific to cocoa, how did we build a new energy industry? Next slide, please. So when we think about bioethanol is not new. It's not a new fuel. It has been used by other companies. The challenge has always been, how do you make bioethanol scalable? How do you make it affordable? How do you make it accessible? How do you make sure that the way that households purchase charcoal, the way they purchase other fuels such as LPG, the way they purchase kerosene, which is literally at their doorstep, that bioethanol achieves the same or even better. So when you think about it, the impact across, from an economic perspective, it has a lower cost than LPG. LPG is limited in scaling to low-income areas without subsidy. When we are talking about production of bioethanol, it requires feedstock. So we're talking about farmer income, additional farmer incomes, and there is new tax revenue, because but when you think about the model that we and other companies use, means that government can be able to trace it and can be able to track it, to tax it. From a social aspect, it is very safe to handle and transport. In terms of burning, it has an ISO Tier 4 rating, which is the highest rating. It burns with a clean blue flame. And has the numbers that Adriana was highlighting. They're no longer, you no longer have carbon monoxide, sulfur dioxide, or even NOx, some of the gases she was alluding to. We make sure that the way that bioethanol burns and using the efficiency inbuilt into our cooker means that none of these toxic gases are emitted. From an environmental aspect, we produce bioethanol sustainably. Right now, we source from the sugar milling industry. It's a byproduct of molasses. We are hoping that as we continue conversations with government, they will look at other feedstock so that we can expand the production, local production of the bioethanol industry. We know it will replace deforestation focused deforestation sourced charcoal. We reduce food insecurity because, as I said, we are keeping trees in the ground. We are reducing the impact on rain-fed agriculture, and we're talking about zero black carbon emissions. Next slide, please. Drilling down into specifics, how did we come up with the innovative solution of delivering it affordably? First off is because bioethanol is a liquid fuel. We decided, how do we make sure that we can transport it using pre-existing infrastructure rather than reinventing the wheel? So our starting point was, who are the subject matter experts in terms of sourcing and transporting liquid fuel? And this is easy because a lot of the oil companies do this and do it very well. They've done this over years. And we have partnered, we did we reached out to a number of them, and we narrowed down to Vivo. So we have partnered with Vivo, and we make use of their existing infrastructure to source the bioethanol both locally and internationally, and they're able to transport it for us all the way to either the large tanks at the port down to the petrol stations, which is where we are able to actually pick up the fuel from. Next slide, please. So just walking you through how we distribute it. So as I said, step one is the way we have partnered with Vivo, who transports it for us to petrol stations, to the service stations. Now, at the service station, most companies in Kenya had underground tanks that were dedicated to kerosene. Now, once kerosene purchase moved from the petrol station closer to the house, they were left with this infrastructure. So we converted the kerosene underground tanks. They're converted to support bioethanol. And what we've done is, as I said, we use technology. What we do as a first step is we place our first piece of hardware, which we've innovated ourselves, we developed, and we place on top of the underground tanks. And that is what we call a smart depot system. Now, this smart depot system is able to monitor what is happening both underground and also as and when fuel is being deposited into the underground tanks or when it's being dispensed. And it's able to send information to our network operations center, which is currently based in Babadogo in Outer Ring. Now, until the point of the underground tanks, the fuel still belongs to Vivo. We then lease micro tankers. The micro tankers, they're micro because they have a capacity of 3,000 to 5,000 liters. The underground tanks at the petrol station have a capacity of between 30,000 to 50,000 liters. So the micro tankers are fitted with a similar box on the back. So you see the small box on the back of the tanker. It's called a smart tanker system. So again, that enables us to monitor what is happening within the tanker in terms of the bioethanol, and also monitor the tanker itself. So through communication between the two systems, the tanker is able to collect fuel from the underground tank. Now, the micro tanker is also small because it needs to navigate the narrow roads in a lot of these high population density areas primarily across the 5 cities. And the micro tanker is able to deliver fuel to a network of cocoa fuel ATMs. Now, when you think about ATMs, I'm sure some of you may have seen the cocoa ATMs. You may also have seen milk ATMs across the world. This is technology that is not new. And also the typical ATMs that you get money out of. So we borrowed from that. We have built, we developed and built and produced our own ATMs that we call cocoa points. Now, these cocoa points are installed in shops close to where our customers live. So we have a partnership with the shopkeepers who we call agents. They provide us space to install our cocoa point and to make sure that it's always available, it's always open to refuel, and also for customers to be able to come in and buy the fuel. And in return for them, for what they get, and also marketing to their customers, they get a commission on each cooker sold and each liter of fuel. So there's additional revenue. Majority of 75% of these agent shops are female owned, because we realize that in this clean cooking space, it plays within the strengths, to the strengths of women. Now, when we look at from the consumer front, what do they get? They get a 2-burner cooker that comes with a 2.3 liter reusable canister. Now, it's a smart canister. The canister is smart. It has an NFC chip that enables us to connect that canister to a consumer's mobile number. So it's very similar to an ATM card. They're able to have their mobile number becomes their account number on the Cocoa Cloud, and they're able to open up a wallet, which they're able to fund using mobile money. So that is how we are able to track and know how frequently customers buy fuel, how much they're buying. We are able to speak to when a consumer transitions from charcoal or firewood. we're able to show, when you're talking about verification and the integrity of the carbon credits, we're able to show the customers' behavior, their purchase behavior, and thus we're able to speak to the quality and the integrity of our carbon credits. Underpinning this, number 6 is our Network Operations Center, which, as I said, is in Baba Dogo. And that way we are able to monitor all the data points being sent from the smart systems along the way. The only piece of hardware that does not communicate with us is the cooker. The cooker in the house does not speak to us. We are only able to understand purchase behavior from the purchases through the smart canister. We do also have a customer care call center where customers can call toll-free and be able to have questions relating to this new technology that most of them are getting to learn, getting to interact with. They're able to get responses too. So that is the innovative solution. But also underpinning this is what I'm speaking about, carbon credits. Carbon credits are what are enabling us to be able to subsidize the price of the hardware. So to give you an idea of how much we have subsidized, the 2-burner cooker retails at 1,550 Kenya shillings, which is just about $10 or slightly under. The ethanol, we're able to retail it at 76 shillings a liter, which is just about 45 US cents. So we are only able to subsidize to those levels using carbon credits or carbon financing. Next slide, please. Now, in terms of our impact over the last 4 years since we launched in 2019, we are just about to knock 1.2 million households. We have coverage of 35% of Nairobi metropolitan. So when you go to a lot of these areas, if you visit Kayole, if you visit Githurai, if you go even beyond Nairobi into Kisumu, Nakuru, Eldoret, Bungoma, we are present. We have increased our coverage into 15 counties across Kenya, and we have over 2,800 of these cocoa points across the country. So by our measure, we have about 4.7 million Kenyans eating food that has been cooked on the cocoa cooker. Next slide, please. This is an image of what happens at the petrol station. So this is actually an actual micro tanker, smart tanker. And this shows the tanker. This is the smart tanker system that is able to communicate when it is determined that the tanker's GPS locations correlate with the GPS locations of the smart depot system. Then the driver will receive a one-time password which he keys in, and he's able to open the back, and they're able to connect the piping to the underground tanks and be able to dispense fuel. Next slide, please. And this is at an actual neighborhood. So you see, they have to be literally very close to the cocoa point. So this is what actually when they are connecting. So they connect through an external unit. And once again, we determine that the GPS location of the tanker correlates with the GPS location of the cocoa point. They're able to open it up and dispense fuel. They dispense fuel with majority of the cocoa points in high population density areas. They're visited every day. Some agents have up to 3 cocoa points because of how many customers they've recruited, whereas some agents maybe get a refill on a lesser frequency, depending also on the population density. Next slide, please. And this is an actual happy customer. On the left-hand side is the canister. It is very easy to carry. We recognize, based on the 4 years that we spent doing our R&D, a lot of mothers send their children. So you find that when you walk around the neighborhoods, you'll find children carrying the canister. It is very hardy. It is reusable. It is not single use. And on the right-hand side, she's buying. She has docked the canister into the cocoa point. And when you put the canister, it recognizes you, will greet you by name. And what we've done is also we've enabled a system where you can buy for as little as 25 shillings. 25 shillings is enough to cook for a day, up to filling the canister. Since this photo we've reduced now to fill the canister, which is 2.3 liters, we'll spend 179 Kenya shillings, which is just about maybe $1.10, and that for a family of 4 can cook for a week. We do understand that different families cook different meals. You cook cereals, we cook, you could be cooking ugali, you could be cooking a protein, but this is based on an average family of 4 cooking for a week, or it can cook up to 20 meals. Next slide, please. And then in the house, it is easy to, the two-burner cooker can be placed on the tabletop. It doesn't take up a lot of space. The canister again is docked, the smart hatch. There's a smart hatch in the middle, which is the point where the canister is placed. So it requires you put the canister, you dock it in, you twist it, and the twisting is what enables the fuel to start dispensing into the canister. We've made sure that when the canister is dispensing fuel, the cooker, which has a regulator, you cannot open the regulator, so you cannot light it. So again, that's a safety feature. It requires removal of the canister and placing it a bit of a distance and closing the hatch before you're able to open the regulator and be able to light. And on the right-hand side, as you see, is a smart customer just being able to cook with it. Next slide, please. And this is a view on the left-hand side, is a view of our network operating center. What you're seeing is the graphing of the data points that we collect. These are from a cocoa point. All the data points we collect, 73 data points from each of the smart depot system, smart tanker system, and the cocoa point, and they're graphed. And we have our team on the back end monitoring. We are actually one of the largest employer of engineers in Kenya. We do employ a lot of engineers, are the ones who are able to monitor this. And if there is any measure that rises above a set threshold, then we're actually able to remotely shut down any of our smart hardware. Right-hand side is a snapshot of our customer care call center. Next slide, please. And this just gives us a snapshot of where we are present. We are present in all the major cities, and then we have expanded into additional cities across the country, and we hope to start rolling out into rural areas over the next 2 years. Next slide, please. Now, how are we transforming lives and protecting forests? Now we speak specifically to how carbon plays. Next slide, please. So this is what we call the cocoa mechanism. So when we generate the carbon credits, we anticipate that we will be able to sell this carbon credits both in the voluntary and compliance market. We do understand the compliance market, which the compliance market speaks to government, and that is where you get better prices. If you get better prices, you're able to reduce the consumer price. As the consumer price comes down, then we have an increased uptake. Remember, we are targeting the low-income households. We really do want the people who cannot access any clean cooking option to be able to purchase our solution. So we don't want to extend ourselves into upper and middle income areas. We absolutely want to target households that are suffering these effects that we are talking about of indoor house pollution. So the higher the price we get of the carbon credits, the lower we drive the consumer price and the higher the consumption. And we anticipate the higher the consumption of bioethanol, the lower the demand for charcoal. And the lower the demand for charcoal, the less forests, the less trees are cut down. The more we are able to sustain these 15 billion trees that you're talking about planting over the next 10 years. They actually need to stay in the ground. That is the part that we need to appreciate. It is not enough for us to plant and grow those trees. We actually need to provide an alternative solution for the people who are having to use charcoal and firewood. And that is why we partner very closely with both the Ministry of Energy and the Ministry of Environment to make sure that we are all speaking the same language. As we provide the alternative, they're also ensuring that they're protecting the forest, they're protecting the trees that are being planted, and they're keeping those trees in the ground. Next slide, please. So that is Cocoa in a nutshell. We pride ourselves that we are leading this transformation, we are leading this transition, and we are aware that across the world, over 60 countries are in need of this solution. We know that over 2.3 billion people around the world sleep every night having eaten food cooked on using dirty cooking fuel. So let's see how we can partner and do away with this scourge that is leading to a lot of these negative health impacts. Thank you.
Thank you very much, Sophie, and I feel like I'm enlightened. And of course, my favorite thing that you said, just because I'm biased, is that you're the greatest employer for engineers, because I was going to ask about job opportunities and livelihoods. So that's really important. I know that we keep talking about STEM and we need to support STEM, but if there's no job opportunities, then people transition to other areas. So I feel like we should also make you an honorary engineer and to move you from public relations, because we need engineers that can speak like you. So here, Sophie has talked about an integrated system. I feel like Cocoa, exists because there is some hardware and software that already existed, but they integrated that to provide a bespoke solution to local challenges. And I think this is what we've been talking about, but often we feel like it is you're almost like you're something that we often don't see. So moving from the R&D, research and development aspect to and spending a good amount of time on it, and then finding a way to start out in piloting and then scaling it up. And for us, all of us who have shambas somewhere, we're waiting for you to come to the rural areas so that we can also get cocoa in our households. But with that, I would like to pause here and ask if there's any other questions that I haven't tracked, Victor. There, I see it. So I'll put this, is there one, Victor, that I missed?
Not that I can tell at the moment, no. So we can proceed for now. Yeah.
Okay, so we can proceed, but of course, she stays on with us to answer questions at the very end of the session and part of our Q&A and discussion. So stay on. So without much delay, I would like to introduce our final speaker, but last but not least, obviously, we would like to welcome Professor Adelaide. Adelaide is an accomplished associate professor associated with the Environmental Health and Governance Center at African International University. With a career spanning over 17 years, she served as an educator, a mentor, and a research scientist. Adelaide brings extensive experience from various sub-Saharan African countries and the UK, particularly in the field of health systems, strengthening within communities and hospitals. In her role as a trailblazing investigator within the Chamha project, Adelaide has investigated the interplay between climate change, heat exposure, and their impact on maternal and neonatal health in rural contexts. She has co-designed and piloted interventions aimed at reducing the adverse effects of heat on mothers and neonates on the east coast of Kenya. The impact of her work in this regard has resonated significantly on a global scale. Most welcome, Adelaide.
Thank you everyone for having me, and good morning, good afternoon, and good evening, whatever you're calling. And thank you so much, Victor and Palapi, for the opportunity to speak in this conference. So I'll be speaking on the health, I'll be advancing the health case for improving maternal and neonatal health in East Africa. And specifically, I'll be focusing on the climate and extreme heat based on some of the research findings we have from our consortia. Okay, so two things stand out. What we know is that there's a problem from scientific point of view that the problem is that there's disconnected air pollution and climate change approaches, and yet the impact of the two strands tend to reinforce themselves when it comes to the impact on human health, and that the full extent of the interaction between climate change and air pollution remains poorly understood in East Africa, because climate change, scientists who are looking at climate change are looking at it separately, and air pollution is being addressed separately, and the intersectionality is poorly understood. So we have the problem and we have that gap. So we know 4 facts. Fact 1, we know that sources and contribution of climate change is as a side of burning fossils, which is a major source of air pollution and also releases greenhouse gases contributing to climate change. And number 2, for sure, we know that climate change has an influence on air pollution, that changes in climate patterns may influence atmospheric circulation, precipitation, and pollutant, which is a known fact. And we also know that intensified heat waves, heat waves may intensify climate change, worsening air pollution, which actually affects by increasing ground level ozone layer. And what we know, number 4, is that health impacts of both air pollution and climate change have significant overlapping health impacts, whereas air pollution this can lead to respiratory and cardiovascular diseases. Climate change may exacerbate some of these diseases and also may exacerbate conditions related to asthma and allergies. So therefore, what we're saying is that these two phenomena cannot be studied in isolation. So what I'm going to do in my presentation, I will first highlight some of our key findings from the Climate Heat Maternal and Neonatal Health, that's a CHAMNA consortium. Especially, I'll be looking at how heat exposure impacts maternal and neonatal health. Then I'm going to highlight the case for including or mapping studies on air pollution and heat exposure on human health together. So first, let me talk a bit, introduce, because the presentation I'm making on behalf of the CHAMNA consortium members. CHAMNA consortium members come all over from Africa, Europe, and North America. In Africa, we have Kenya, South Africa, and Burkina Faso. And in Europe, in London, in UK, we have London School of Hygiene and Leeds University. Then in South Africa, we have representatives from Leeds University and the MRC Canada. Then we have other members from University of Botswana, University of Oslo, and University of Washington in America. Also, we have representatives from University of Karolinska. So it is a diverse transdisciplinary consortium with different members that are studying the impact of heat exposure on maternal and neonatal health. So the field site for our work was in Burkina Faso in 2 areas, and in Kenya, it was on the east coast of Africa. So overall, this is just an overall sweeping statement. What we found out from our study was that in pregnancy, a woman's pathway to delivery, from pregnancy to delivery in postpartum with their babies and their newborn, heat is perceived to have a harmful effect on maternal and neonatal health, and it's likely to affect generations and generations to come. So from our study and from the existing epidemiological literature, high temperatures increases the risk of congenital abnormalities, preterm birth, stillbirth, hypertension, or preeclampsia. May also affect or increase or rather exacerbate gestational diabetes, and may also exacerbate malaria and other infectious illnesses related to heat. But we also did find that heat has an effect or a bearing on behaviors. For instance, when it's hot or in periods of high temperatures, heat is likely to reduce time women or mothers spend breastfeeding due to the discomfort caused in the heat. And women who are pregnant are more likely to attend antenatal care, and those that are breastfeeding are more likely not to attend postnatal care due to the fear of being in the heat or other health system factors in the facilities. Also, heating is likely to make women supplement breastfeeding, that is exclusive breastfeeding, may not be possible. And even the use of mosquitoes for women when they are pregnant, mosquito nets for women, pet nets for women when they're pregnant or in postpartum, or using pet nets for their babies may not be possible in periods of heat. So what does this mean? This means that more women and their babies and their children are likely to be more anxious, exacerbating mental health problems. And anxiety is amplified by many factors, for instance, the impact of climate change on the ecology and also on agriculture. And all these variables are being diminished by the impact of climate change, meaning that women don't have things like water, food, and all that. It even impacts on their relationship. So all this brings a lot of anxiety for women, for moms who are pregnant, and also in postpartum, including their babies. So what we know actually from epidemiological data is that climate change has or is likely to reverse all the gains we've made in East Africa in the past 3 decades. Is likely to increase mortalities and morbidities for children even up to age 8. And that's what we call climate change penalty, in that even if you look at some of the statistics that are emerging, there's compelling evidence that, for instance, if you compare the figures here, that the annual average number of heat-related child deaths for period 2005 and 2014 are higher than if they would have been observed climate change. So it just shows a bleak future. So then for the baby, we found that babies born in periods of heat or living on the East Coast or who are living in similar conditions, the plight is even more than children living in other places. It's really difficult to take care of babies in the heat. Breastfeeding is not possible, and most babies are born underweight. And what we found out from the field was that most of the babies, because we did our research when it was really hot, and most of them were born with damaged skin, blisters in their mouth, on their face, and it was not possible. And because most of them were underweight, kangaroo care wasn't even possible. Exclusive breastfeeding was not possible for the mother. And it's not only the condition of the baby, but it's also the condition of a mom in the heat, and also other variables, like the health systems, agriculture, malnutrition, compound together, making life really difficult. And that just continues to show the bleakness of climate change and its detrimental impact on maternal health. So this is some of the stories moms told us, but I'm not going to go into it. This will be shared on the on HEI website. You can go and read some of the stories they told us and how they struggle in the heat. So then we come here. So this is one of the things we found out that we did not investigate, and that's why we are proposing a strong case why climate change and air pollution interaction must be addressed collectively and not in silos. So take an example, like in rural Africa, we know most of us, we usually have the main house and we have a small kitchen where we cook. But some people, some families cannot afford that. They have, like where we did our research in the east coast of Kenya, people only have one house, and this house, most of the houses on the east coast and some parts of Africa may not have ventilation, may not have windows, may not have chimneys or vent to disperse exposure to heat. So that's what we found. And in one room, you'll find children are there, newborns are there, moms are there, there's heating, there's smoke, there's dust, because some people are lucky to have cemented floor, but most of them have mud floors. So all these interact and has impact on the woman. She's exposed to smoke, she's exposed to the dust, she's exposed to the heat from cooking, and then there is an additional part of heat from outside. So all this makes the condition unlivable for these mothers. But what we are saying is that this has not been examined, it has not been documented, and there's need for more research to come forth so that we can begin to unravel which of the 4 variables has more intensity on the health outcomes of mothers and babies. So then from our research, we come up with a framework that can help policymakers begin to think of areas they can address. So from the left, there's exposure to extreme heat. So we have heat events with hazards highest. We found that we have vulnerable setting, people living in the slums or in urban heat islands, or most houses in low-income rural areas have the highest hazards for heat. And this is because the impacts, maybe dehydration and electrolyte imbalances, may lead to abnormal glucose metabolism, may heighten stress or hormones, and raise maternal temperatures. All this leads to maternal anxiety and has the consequences of health, as I've talked about in the other one. And then we found that poorly constructed buildings like houses and health facilities with low thermal resistance. And I think this is really important, that where actually there's more air pollution happening in the health facilities, and more health facilities are experiencing heat because of the kind of material that they've been set up with. So children, moms in this may, so this is what we found in the context that at home it's hot, it's polluted. And in some health facilities, it's hot, it's polluted. So you find that the journey from home to the health facilities is odd. I mean, home is not safe, some health facilities are not safe. So all this needs something that policymakers need to begin to think about. And then also we found high risk pregnancies and people living with disabilities, the old age, and all these have impact on how they experience heat, because it may heighten the intensity of the impacts. So I will leave this on the website. You can go through and look at the impact and some of the outcomes. So all I've discussed here today, we have published it in 2 papers. One of them is in social science and medicine, and another one is in BFC pediatrics. So we have tried to document, because some of the early work that has been done in the continent that is documenting the impacts of heat on maternal neonatal health. So you can go look at the paper. We've documented intensively what we found, that as temperatures rise, the future for pregnant women and babies is bleak. So what are the solutions? The solutions are that we require tailored interventions, including raising community awareness about the health risks of indoor pollution and heat exposure. Also, there's need to promote behavior change by engaging with communities, the way we've been doing, where we've been working, try to engage with communities so that they can understand heat is a risk. Because where we've done our studies, people have always experienced high temperatures, and therefore they have normalized these temperatures. And it's very hard for them to detangle what is heat exposure, what is drought, or what is just the normal temperatures, even though they're experiencing these effects. So it's now time we all need to go out and begin to make this community, create awareness in these communities and inform them, you know what, heat and climate change is a reality. They need to take up protective measures. So I conclude as 4 conclusions. Number 1, that to achieve social development goals and climate change and air pollution, there's need to embrace system perspectives whereby we can look at these challenges in a holistic approaches and foster collaborations to lead to sustainability, and that we need policies that can interact for sustainable development. And this cannot be done in like addressing the two variables in isolation. This will help us to develop new knowledge through research to inform policy. And that one thing that is lacking in our continent is lack of long-term cohort studies. Usually studies are very, they target, I mean, they're designed for very few months, and they don't seem to follow up population so that they can exclusively document the health of the population. So we need long-term cohort studies so that they can shed light on the complex interplay between air pollution and climate change and their impacts on the health of the population. So I will stop there, and thanks for listening.
Thank you very much, Professor Adelaide, and thank you for breaking down that study in a way that is understandable to all of us who are not even in the health sector, because it's quite alarming to understand that the impacts stretch a lot further than we even present in our different studies. And with that, if you allow, I have a question already for you, Professor. Then I want to put to you, studies in the health effects of air pollution in East Africa, they're often short-term. When you've done your literature review, I'm sure you found a lot of short-term studies, but never the long-term ones. How does your research investigate long-term health effects, particularly in children? And how can programs such as the one for CHAMNA, which is the consortium, address the need for research on the interplay between heat and air pollution, as opposed to addressing the two phenomena in silos?
Okay, yeah, that's a fundamental question you've asked. And I'm not sure how to answer it, to be honest. And first of all, I think we just need to look at why most studies in East Africa or in Africa on this aspect are short-term. They're short-term because there's no funding. When the donor funds money, they say, okay, we just need 2 years, 6 years, and we're limited. And our governments don't support research. Research is not, scientific research is not fully embedded in our universities, and people don't take it seriously. So it's the donor who directs what they want. When they put an ad, they only have funding for 9 months. And those are like serious conversations we need to discuss, that we need research, like what they do in Europe, a cohort for 20 years. People will die and leave a cohort going on for 50 years, for 60 years. The baby boomers are still being tracked from 1960. We don't find such studies in our continent. However, you've raised a fundamental question. For CHAMNA, again, our study was only for 4 years, and we had very specific work packages which we were working on to understand the impact of heat on maternal health. And we are hoping that we can get funding that actually can support cohort studies so that we can be able to follow a population, use like a life course theory and follow a population, maybe follow women from pregnancy and their babies, their development in school and neurological development up to teenage age, so that we can actually know what is happening. We don't have it. There's no money, and I can't answer that really. Yeah.
Indeed, it is a rallying cry for a lot of our researchers, and perhaps also our local policymakers and our research and development within our local institutions needs to support this kind of studies which go beyond the finding cycle. But Sophie, I hope you're still with us. Sophie, are you still there? So I'm still waiting for...
Yes, I'm here.
Hi, Sophie.
Hi.
So I have a question that is coming to you. The question is, from your experience working across the country in rural and urban settings, how do successful technologies and innovations respond to local and institutional needs?
Thank you for that question. I think Our experience right now encompasses rural. Yeah, we are still in the early stages of expanding to, relates to urban. We are still in the early stages of looking into rural. But when you're talking about technology, to be honest, a lot of these things, we're talking new things, I think, both to customers in urban or rural areas. Yeah, so it requires, what we've seen as a game changer is trying to adapt, yeah, to behaviors, yeah, rather than trying to impose, yeah, completely new ways of doing things. If you have to lead to an absolute change, behavior change, yeah, I think it's important for you to embed yourself within that community, understand how they do, why they do what they do, yeah, and then see how will my solution help to make their life easier, and be able to show them the benefits that this technology is bringing them. I think it goes with everyone. When you're talking about even the phone, even, you know, rather than walking, taking a car, taking a bus, we always do a cost-benefit analysis. I don't think it's any different with anyone, anywhere. It's just people need to see the benefit. For us, we added multiple steps to the process, yeah, but we were able to show them what are you benefiting by the fact that you have to load your, you have to load your wallet, you then have to take this canister, you have to go look for your agent, look for the cocoa point, fuel the cocoa point, come back, put it in the cooker, empty it, it takes time, but the benefits to a lot of consumers are worth it when they see what they're gaining at the end. So I would encourage, embed yourself within the community. Yeah, let it seem to be more you responding to the community rather than us imposing something that we think or we believe that the community needs.
Thank you very much, Sophie. And actually, I have a follow-up question, or from that, you have Onesmus here, where he's coming from Kaloleni, and it's one of the places, I guess, that you did the study on, and he agrees with your findings. So he wants to ask, are there specific interventions that is community-led that you can recommend? And secondly, he's asking if you're going to come back to the community, or you plan to come back to the community to disseminate these findings to the community, if you're not already there. No, actually, I said to Sophie, and Sophie was like, no, I don't know what you're talking about. Before I went like, wait, Onesmus is addressing this to Adelaide. So Adelaide, do you want me to repeat the question? Because you were like, so it is from Onesmus, and he's working in Kaloleni.
Yeah.
And you have done the study there, and he agrees with the findings from your study.
Yeah.
So he wants to understand if there are specific practical interventions that can be community-led that you can recommend. So to prevent some of the impacts that you are showing us. And secondly, if you're planning to come back to the community. And Sophie, don't smile so hard. Don't think that doesn't apply to you, but to Professor Adelaide.
Yeah, so we have, okay, so thank you so much for raising that question. We have done in the past, last year, we did a behavior change intervention where we mobilized the whole community to educate them on the impacts of heat on women. But also we used a system approach to mobilize the whole community in around Rabai, whereby so that women, I mean, the key support systems so that they can begin to come together and help women in the periods of pregnancy take up some of their roles so that women can be at home. But we have a range of interventions that have come up from our co-design workshop. And I know we will be picking on some, but there's issues around cleaning the environment, cleaning the health facilities, adjustment on the built environment, which is a huge one. We need to work with the Ministry of Health, Ministry of Housing, so that some of the housing can be adjusted so that they can have ventilation. The issues around mental health and violence that is coming as a result of heat, climate change increase, actually that's a big one. And we hope the Ministry of Health can pick up on that. the whole issue around water provision of water as indirectly relates to climate change, but that's a big one also there that requires government involvement, which is hard, because you're talking at a macro level. So there are small ones, the ones we can do at the household level, like change behaviors, but then there's the big ones at the macro level, which we need to work with policymakers, but we need more informed evidence to be able to convince policymakers. So what we did is like pilot, we need to go in and get more evidence that can, like epidemiological evidence, clinical evidence, and then we can sit with policymaker to influence that policy. Yes, with that said, I am coming back to Kilifi in March. Thank you.
Thank you very much, Professor Adelaide. And perhaps there's another Sophie and consortium on the call that will start looking at cooling interventions for local solutions, because again, we need to move to that. So now that I'm putting it on your table, Sophie, I'm sure you have enough on your plate as it is. So Victor has told us that we're doing so well on time that he's going to open the floor for some questions. It's some burning questions that you can just put your hand up. Truthfully, I don't even see where you put your hand up on Zoom. I've forgotten, but I'm sure you can. You guys are much more clever than I am, and you've figured it out. So any hands up, put your hands up, and we'll be able to unmute you and so that you can speak from the floor.
There is one question for Sophie in the Q&A as folks. Can I read it out?
Yes, because now you try, I might throw it back to Adelaide when it's meant for Sophie, so you better read it.
So it was Ethan. Or did you answer this, Sophie? I think.
Yes, I did.
Okay. So do you want to say a few words on that as well?
Yeah, I think as this the question related to how we secured funding. Yeah. When you think about an innovation, when you talk about someone making an investment in an entity, you need to find people who are willing to walk the journey with you, knowing that it could go either way. Yeah. And when you think about investors, potential investors, there are not too many people who are willing to fund you endlessly. You can imagine we developed 6 iterations, yeah, over 5 years. Every time they come, you show them what you've developed, but you're not yet ready to go to market, yeah, 5 years. You need someone who will fund you through that process. And eventually when you say, okay, now, by the time we got to version 6, we had something that we felt was right for the market now in 2019. And we told them, now we will go with this into the market. We've iterated a little bit since then, since, as you'd expect with new technology, you're constantly learning. Yeah. But for us, the people who walked this journey with us along were family offices. Yeah. At the beginning, you tend to find family offices primarily in Europe. Yeah, they walked the journey with us. And then as we got to a point where we launched, and now we are looking at expanding, building a factory, setting up offices here, employing people, we opened it up. Now at that point, they're spreading the word. We are getting other people who came in and invested. So a lot of them were shareholders. Now that we are at a point where we are more visible, we are better known. And we always invite people to our Babadogo offices for us to show them so that they walk what we are doing rather than them just listening to us. We can PowerPoint people to death, but we always say, and we can impress you. Yeah, you can really look at it and say, oh, that is very impressive. But we prefer for people to come and see how it works and talk to actual live agents and customers. Now that we've gotten to that stage, we're now at the stage where we're starting to look at debt. So it's been a long journey, and even the fact that we're expanding, as I said, it's 60 countries. Yeah, we're already looking at, we've launched into Rwanda. We're already looking at the next 10 countries across Africa. We're looking at countries in Latin America, countries in Asia. All of those will require financing. So just as you'd expect with a company that we're a startup that is scaling up, we'll eventually get to a point where we are a corporate now. We stop calling ourselves a startup. The next phase of funding is normally debt. Yeah.
Thank you very much. And I think I have gone to so many different sessions where people talk about the lack of availability of funding and financing and investment. And I think what you're showing us is what you can do with what you have, and how you can move from the research and development scalability to actually come into our doorstep any given day. So, and to Adelaide as well, really, I think you've put it to us as a challenge, in terms of working in silos and in areas that we cannot even begin to fathom for us working that atmospheric science side, in understanding that, heat stress translates to a lot more than we present. And there's a scope and there's an area of collaboration that is needed to understand the interaction. And to HEI, I think I want to, and also to the participants online that have been posting questions, that have been listening keenly, that have been introducing themselves, I want to encourage you on these case studies that are presented, even you in your research work, to start understanding what are the areas of collaboration that can be catalyzed from this session, so that we have solutions that provide energy at our doorstep that is clean, that is not impacting our health, our food security, our surroundings, our environment, our ecosystems. So there's that opportunity, and I think what I do like from this that you have done very differently is real case studies of what is being implemented in the field and a challenge going forward. So for us, I would like to encourage all our speakers and panelists to reach out through our different avenues provided by HEI as we go forward to interact with the audience while we have not been able to reach in this session. And with that, I would like to thank you and invite Victor to close us up, but to say that it's not the end of the conversation, it is just the beginning. And as always, I'm really excited to learn new things. Thank you so much.
Thank you, Adriana. And first of all, to thank both you and our speakers, Ada, Adelaide, and Sophie, for finding time to be with us and share your great work that you're doing on this topic for today. So thank you very much, asanteni sana. And as we close, I think we have had great conversations. I have put in the chat a link for a survey. We will leave this session open for a few minutes so folks can take just 1 or 2 minutes to give us feedback on what you've found useful in the course of all this webinar series. And to also tell you that we are planning on, so this is the last of the series, but we are planning on doing a few materials for reading. So we'll have a blog post available on our website, and we will want also to do a commentary for probably the Clean Air Journal, bringing together the speakers for today and all the speakers for the previous sessions to kind of internalize, the key messages in the form of a commentary that will go out to the Clean Air Journal. So for our audience, be on the lookout for that in the course of this year. I will not promise dates, but we will try and get that done. And thank you also to the HEI colleagues who have put this together in the background, our communication folks. Thank you so much for bringing us this a very good series. I'll not forget to also thank our hosts and co-hosts for this and previous sessions. So WRI Africa, AirCo, the Respiratory Society of Kenya, the Pan-African Thoracic Society, C40 Cities, among others. Thank you for having supported us throughout this webinar series. And this is, as Adriana said, this is not the end of the conversation. We will continue engaging in East Africa as HEI and look forward to seeing you in the next one. So with that, I think I will draw this session to a close. So we will leave the session open for folks to just take a few minutes, click on the link and take the survey. So thank you so much. Have a good rest of the morning, rest of the evening, rest of the afternoon, wherever you are. Asante.